Hi divers, this is Dr. Kang, the scuba diving stories, and today I'm going to talk about am I bent? Are you bent? Because I get phone calls very often that I have dived during this and that time frame and I feel this and that symptoms. Am I bent? I think I will someday talk about the general diving medicine and decompression, illness, decompression, sickness, and everything. And this will be dealt again, but I'd like to leave a short notice on this subject. Am I bent? This is wrong spelling, huh? People tend to have some phobia on being sick, which I think is a good idea. Before anything gets too bad, if we have the concern, maybe we can treat early enough. Decompression sickness, I think the same principle should apply. It's okay to worry about decompression sickness, but if we worry too much, that can be a phobia. And I like to relieve you from those phobia by telling you how to differentiate the symptoms of DCS and symptoms of other disease. So that's a differential diagnosis. How do we diagnose DCS? There is no blood test, there is no urine test, and there is no X-ray test that can specifically diagnose DCS, except when you have arterial gas embolism. MRIs can sometimes take that out. But in general, there is no diagnostic tool in the hospital. Then how do we diagnose a DCS? It's the first thing is that you have the symptom of DCS. Probably the most common symptom is pain here and there, maybe dizziness, skin rash, and all these symptoms written under the DCS symptom. You need to keep in mind, of course. Also, you need the history of recent diving. You have dived within a certain time frame, and then you have the symptoms of DCS, then you might have DCS. It is safer to consider it as a DCS and act accordingly. It is safer that way than just thinking, hey, this should not be DCS. I have done all the diving within no decompression diving. I've done safety stop. My ascent rate was correct. That doesn't apply 100%. So again, it is safer to consider it or the symptoms as symptoms of DCS. So to be able to tell if you have DCS or not, you should know when the symptoms of DCS should appear. It's 50% appear within 1 hour after surfacing. Some of them even appear during diving, but that's a very serious case. But usually you don't feel it underwater because you're under pressure. And you come out, and in about an hour, there 50% of symptoms appear. Within 6 hours, it's 90% of DCS symptom appears, which means within 6 hours, almost all symptoms appear. So if you have some symptom that's written within decompression sickness symptom, you probably have the DCS. 25% says 25 hours, 95% of the DCS shows. What about the 5%? It's when you give some additional post-dive risk factor to yourself after 24 hours. So what kind of risk factor do we have? It's flying after diving. As we know very well, we recommend a minimum of 18 hours after many dives, many recreational dives, many no decompression dives. But it's usually 18 hours and longer. But flying even after 24 hours, we have cases of patients showing typical decompression sickness. So we have to keep in mind, flying always carries some risk factor. But it's better if you wait more than 18 or 24 hours. Traveling to high altitude area, driving to the high mountain, that also is a risk factor. Hot bath for a long time. In Korea, in China, Japan, hot bath is very popular. And when you do not feel well, we go to some public bath or public sauna to do this. And this is certainly a big risk factor too. If you stay in hot water, hot tub, very long. Drinking too much after diving certainly gives you some additional risk factor. Heavy exercise as well. And my wife wanted me to put this. If you do not respect your spouse after diving, you can get bent. So today I talked about the am I bent or not, or are you bent or not. It's you have dived and you have decompression sickness within 24 hours, then you have to worry about the decompression sickness and you have to act accordingly. But let's say you have dived 3 days ago and now you have general malaise, muscle pain, joint pain, then you probably have acute tonsillitis other than DCS. So just remember, most of them comes within 6 hours, maximum 24 hours. And unless you have some additional risk factor, you are not bent. And I don't want to be bent. Thank you for your listening. Bye-bye.